Please tell us the correct option. We want to be sure. So I wasn't able to display the question, but the question, it was basically, you have a patient that just came back from a thyroidectomy and they have clinical manifestations of, like, they're going into shock. They're bleeding out. What are you going to do? And you had to put your nursing interventions in the correct order. Now, here are your choices: increasing IV fluids, control the bleeding, um, confirm the patient has a patent airway, and decrease the patient's anxiety. Those were your four options. What are you going to do in order of priority? The first thing you're going to do is make sure your patient has a patent airway, because guess what? We don't care about anything else if our patient's dead because they're not breathing, right? We don't care about the bleeding. We don't care about the anxiety. We don't care about fluid and electrolytes. We care about nothing if our patient's not breathing. Airway is always comes first when it comes to prioritize. Am I saying that right? Prioritization. That sounds wrong to me, but you know what I mean. Priority. So you're going to make sure the patient has a patent airway. After you've made after you've made sure the patient has a patent airway, then you're going to control bleeding. Remember, in nursing school, you learned ABCs. What does ABC stand for? Airway, breathing, then circulation. So you got to make sure the patient has a patent airway. You got to make sure they can breathe. Then you worry about the circulation, right? Now, that leaves us with two more options. One of the other options was to decrease a patient's anxiety, and the other one was to increase fluids. Well, after you made sure the patient was breathing, after you make sure you controlled the bleeding, then you're going to increase fluids. Because I want you to think about it. What if you chose airway first and then after that you gave fluids? You're giving fluids while that patient's still bleeding. What kind of sense does that make? Remember, I told you, whenever something's wrong, you want to control what's wrong first before you do something else, right? If the patient's having a bad transfusion, you're going to stop the transfusion first before you do anything else. Same concept. So you're going to make sure the patient's breathing. You're going to control the bleeding. Next, you're going to go ahead and give the patient IV fluids. Why? We're trying to keep that line open. We don't want that patient going to shock. Last, we're going to decrease that patient's anxiety. I'm sorry. At the end of the day, who cares about that patient's feelings if they're dying, right? When it comes to fear, when it comes to patient education, all of that good stuff, that's on the top of Maslow's hierarchy of need. That is not our priority. Our priority is always going to be the patient's physiological integrity. Anything that's putting their life at risk. We're going to worry about airway. We're going to worry about breathing. We're going to worry about circulation. We're going to worry about fluid and electrolytes. We're going to worry about the patient's glucose status. We're going to worry about dehydration. We're going to worry about the vitals. Anything that can physically kill your patient, that's going to be your priority first, right? Anxiety, patient education, even pain. That's not a priority. Matter of fact, pain is only I can't speak. I hate this, and I'm not going to do this video over again. I'm going to keep going. Pain is only a priority in 5 situations. What are those situations? If you've been following me, okay, say it along with me. What are those situations? Cancer, sickle cell, burns, stones. And when I say stones, I don't care what kind of stones they are. They could be calcium, they could be struvite, they could be gallbladder, they could be kidney. We don't care. If it's stone pain, that patient's pain is a priority, needs to be addressed. And last is myocardial infarction. If that patient's having a heart attack, they need that morphine, right? Outside of those 5 conditions, pain isn't a priority. It doesn't fall under physiological integrity. I hope that cleared this up for you.